Hi everyone, I'm Davud Mehrabi. I have a PhD in Mass Communication with a special focus on health communication. For over the past 10 years, first as a journalist and now a research faculty member, one question has always been on my mind. How can we simplify health information and research findings, making them accessible and understandable to everyone? When we truly understand health information and research findings, we make better choices, and these choices lead to a healthier society. This unique blend of journalism and health communication persuaded me to create the Health in Simple Words YouTube channel. My goal is to turn health information into action, bridge the gap between experts and the public, and work together toward a healthier society. Let's get started. 5 simple science-backed health tips that will change our lives. These tips can help us to make a real difference in our health. Tip number 1 is move more, sit less. We often hear that sitting for long hours increases the risk of chronic disease like heart disease, hypertension, diabetes, and so on. But the good news is that various studies and guidelines put emphasis on physical activity, and even some of these studies and guidelines call physical activity a miracle cure. According to these studies and research, there are 2 main recommendations that we can follow. First is aim for 100 to 300 minutes of physical activity per week. And the second recommendation is to take a 5 minutes movement break every hour if we work at desk. World Health Organization 2020 guidelines says that for all population, doing some physical activity is better than doing none. UK Chief Medical Officer Physical Activity Guidelines is another supporting document. According to this document, message is clear. It says, if physical activity were a drug, we would refer to it as a miracle cure, due to the great many illnesses it can prevent and help treat. According to this document, our health is being damaged by inactivity, but the good news is that even small changes can make a big differences over time. Physical activity is not restricted to any specific group and is recommended for all groups from birth to 5 years old. This infographic shows which kind of physical activity is important and can help to improve health of children. Physical activity for 5 to 18 years old also recommended here. According to this infographic, aim for average at least 60 minutes per day across week is recommended for this age group. Physical activity for adults and older adults shows in this infographic. According to this infographic, at least 150 minutes moderate intensity per week for adults is recommended, or at least 75 minutes of vigorous intensity per week is recommended for this age group. Tip number 2, eat for energy and longevity. Eating is one of life's greatest pleasure. The instinct for eat is one of the fundamental drives that remains active from birth to death, playing a very constant role in our health and well-being. According to various studies, they have 2 main recommendations. Number 1 is follow a Mediterranean diet, and the second recommendation is cut back ultra-processed food. Let's have a look at various studies. According to this study, the Mediterranean diet seems an ideal nutritional model for cardiovascular health. There is another study. According to this study, the Mediterranean diet is one of the best studied diet for cardiovascular health. The Med diet has been shown to reduce the burden or even prevent the development of various diseases such as cardiovascular disease, breast cancer, depression, colorectal cancer, and so on. According to this study, total ultra-processed food consumption is associated with higher risk of various diseases. Overall, this study supports current recommendations to limit total ultra-processed food consumption. In another study, greater exposure to ultra-processed food was associated with a higher risk of adverse health outcomes. Tip number 3, stay on top of preventive care. We all heard countless times that prevention is better than cure. But the question is, do we really practice it in our daily life? Various studies and sources put emphasis on preventive care. Two recommendations for all these studies. The first recommendation is plan our annual checkup and stay up to date with screening. And the second recommendation is to keep up with recommended vaccine. Various studies pay attention to these recommendations, and we have a look at these kind of studies.
Based on this document, preventive care is recommended when we don't have any symptom and haven't been diagnosed with a health-related issue. Based on our age, gender, personal health history, and current health, we and our healthcare provider will decide what preventive services are right for us. In another document, preventive healthcare strategies are essential for promoting individual and public health, reducing healthcare costs, and improving overall quality of life.
Tip number 4 is prioritize our mental health. Mental health is just as important as our physical health. It affects all aspects of our life, like how we feel, how we sleep, how we think, and how we behave. If we look at various studies about mental health, there are two actions that is recommended among all conduct these studies. Action number 1 is to practice mindfulness or meditation for at least 10 to 15 minutes daily. And the second recommendation is build a strong social connection and reach out to family members and friends regularly.
According to this report from World Health Organization, mental health after COVID-19 is a serious concern, and there is a wake-up call to all countries to set up mental health services and support. The result of a survey asked people in 31 countries shows that mental health has overtaken cancer and obesity as the health problem most Britons worry about. According to this study also, there is a sharp rise in recent years in mental ill health.
Tip number 5 is boost our health literacy. I can talk about health literacy all day long. But the main point of health literacy is that we have correct and sufficient information to make better decisions. Various studies look at health literacy as one of factors that is very important these days, as there are a lot of misinformation and disinformation, that this kind of information potentially can impact our decision. So there are mainly two recommendations. Number 1 is use trusted sources for health information. Such sources may be WHO or other reputable public health institution for health information. Second recommendation is ask our doctors better questions. For example, what are the risks and benefits of this treatment?
According to this study, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Health literacy impacts people's health and well-being, and as this study shows, limited health literacy is linked with unhealthy lifestyle behaviors such as poor diet, smoking, and a lack of physical activity, and increased risk of morbidity and premature death.
If you ever struggle to stick to any healthy behaviors and habits, know that you are not alone. I know so many people, including myself, that don't follow these simple tips either. But have you ever wondered why we tend to ignore or overlook basic health advice? There could be countless reasons, but there is a scientific explanation that can help us understand why we ignore simple yet powerful tips. I'll break it down in plain language in the next video. So please subscribe and hit notification bell so you don't miss it.